Hello everyone. Today going to discuss about an interesting topic on skin disease known as lichen planus. Lichen planus basically होता क्या है? इसके अंदर पेशेंट को एक इन्फ्लामेटरी स्किन कंडीशन डेवलप होती है जिसके अंदर रेडिश वायलेट और डिफरेंट कलर्ड पैप्यूलर एंगुलर इन शाइनी पैप्यूल्स डेवलप हो जाते हैं आइदर ऑन द स्किन or on the inside the mouth. Now usually it is an itchy rash that may occur due to an inflammation and that may appear on either in any part of the body, but usually it has been seen that it appears either on the torso or on the wrist or forearms, the back of the hands, usually in the folds of the skin or on the inside of the knees or the joints. नाउ दिस कंडीशन के जो जब डेवलप होती है इसके क्या कॉजेज़ रहते हैं. यूजुअली देयर इज़ नो नोन कॉज दैट हैज़ बीन स्पेसिफिकली फाउंड that can cause this condition, but there are some causative or triggering factors that have been usually noticed in this condition. So इसके अंदर पेशेंट को ज़्यादा अगर स्ट्रेस रहता है due to any worry, anxiety at work or any kind of mental stress or strain, then in those cases this condition can develop. Then in some cases usually patients who are taking antibiotics, corticosteroids, certain hormonal treatments, or who have been diabetic or have hypertensive medicines for a long time, in those conditions also this may develop. Thirdly, the patient who have suffered from hepatitis C or any viral infections as such have a more tendency towards this disease. And fourthly, patients who have suffered from herpes zoster before may also develop this condition. It has also been seen that this condition usually gets aggravated during times of stress also. Now, what are the symptoms of this condition? Usually the symptoms that occur are either on the skin or on inside the mouth. Now, the skin symptoms that appear are usually an itchy rash that develops on any part of the body. It gradually increases. First, it may appear as single papular eruptions that may appear as singular eruptions on any part of the body. Later on, they may coalesce together or combine together and form larger areas or cover larger areas on the skin. Secondly, they are usually red or violet red in color. They cause very severe itching, which may initially be singular as fine lines, white lines, but later on they may get converted into a lacy network. Also, they may cause, like with the itching, obviously there is eruptions and irritability is marked in those cases. And when this condition gets more increased, it may also get converted into blisters or ulcers. Now, in case of inside the mouth, the condition may appear either on side of the tongue, inside of the cheeks, or inside the palate or the mouth. There is very severe itching inside the mouth in these cases. They may form either mouth ulcers later on or apathy that we usually call them. And then usually there may be some other problems that may occur due to this problem, like difficulty in eating or swallowing food or liquids. Now, what are the diagnostic ways that this condition can be diagnosed? Now, lichen planus can be diagnosed either through a biopsy of the skin, microscopic examination, certain blood tests can be done to see any internal infections, and in some cases, since it is by itself very diagnostic in itself, because the eruptions, they are very marked, they are papular, angular, they are very itchy in nature, and they form a violet red color in a lacy network. So it is quite easily differentiable from other skin conditions such as eczema, psoriasis, or other forms of lichen. Now, what are the management and of this condition in general? If we talk about general management in allopathic treatment, they usually give corticosteroid creams, vitamin A for intake, or some other management is done by the various creams and antibiotics to relieve the patient of the itching. But in general management, it is important that the patient has a good health. They should exercise. They should have good eating habits, because this condition is often associated with poor diet and poor exercise. Then those patients who usually lead a sedentary life or have excessive weight gain, in those cases also this condition may develop, where there are certain folds in the skin or there is some other issues. Now next, what other problem occurs is that this patient has many other problems as well. Because of the stress and the anxiety and some other issues, they may develop mental issues as well if the condition is not rectified in time. Now, what are the homeopathic management that can be done for this condition? In this case, lichen planus can be treated with various homeopathic medicines depending upon what the condition the patient is having and what symptoms they have. For example, if a patient has more apathy or sore throat, or there are more itching inside the throat with apathy or small white bluish eruptions inside the mouth, then borix is a very good medicine. Another medicine that we can think of is Merksol, which is good if there is excessive sweating along with the itching eruptions or the problem is on the skin. And with that, the patient has severe itching with sweating, and the more the patient sweats, the more the itching increases. Besides that, they have more craving for sweets and they have some other issues as well. So in those conditions, Merksol can be a good medicine. Then the third medicine that can be given is arsenic, which is a good medicine in those cases where the patient gets relief from general warmth in general. If they do warm gargles or something, they feel better in their itching, or they do a warm bath, then also they get relief. Then there are some other problems that can be associated with these patients, such as excessive anxiety, restlessness, aggravations during the midnight or mid-afternoon time after 12 p.m., or they may have some other issues as well. Then the next symptom that or medicine that can be indicated is oleander. This is a good medicine for lichen planus that occurs on the scalp. And then there are some various other medicines if some digestive issues are involved, and due to that the lichen planus has occurred. Then various digestive problems, to tackle those and to rectify those, needs to be done before treating this condition. Because once the digestion is okay, the condition by itself gets subsided. Then there are some patients who have some issues with their liver, and due to those, like in those patients who have hepatitis C, or persons having viral infections such as herpes zoster and other problems, in those cases also it is important to detoxify the liver and to give treatment along with the management for the treatment of the issues with the liver as well. So this was a small informative video on lichen planus, its causes, the symptoms, and its general management as well as homeopathic management. I hope you have gained some information on this condition that is very common nowadays. And in case you like this video, please share it and have a great day.